All right, folks, we'll be getting started in just a moment. So I wanted to just take a second to introduce myself. My name is Megan Tuster. I'm an Associate Director of Admissions at Stony Brook University's Office of Undergraduate Admissions, and I'm here to help facilitate this session for our School of Health Professions programs. We are joined by Teresa Blaskoff, Director of Admissions and Retention for our School of Health Professions. Before I pass things over to Teresa, I do want to call out that there is a Q&A function in each of your Zooms where you're able to ask questions throughout the program. We'll have time for Q&A at the end, but if there's anything that you want to ask during the session, please feel free to utilize that. Until then, Teresa, the floor is yours.
Thank you so much, Megan. Welcome and good evening, everyone. Thank you so much for joining me. Again, my name is Teresa Blaskoff. I am the Director of Admissions and Retention here in the School of Health Professions. My email is up on the screen, so please feel free to contact me again after the session if you have any additional questions. I just want to put this on the screen so you can stay in touch with us. This is a QR code that you can kind of scan, and we'll send you some more information about our school. So please, I'll put that on the screen at the end too. I'm going to hold it for a second, just so you have a moment to kind of scan that QR code. And like I said, I'll put this again up at the end, but I'm going to go into our presentation now. And I just want to kind of just speak about what you want to get out of your college education. And what you want to get out of your college education is a great job, somewhere that that you're going to be doing this for the next 50 years, because you have to work and you want to love what you do. I'm very fortunate to love what I do here at Stony Brook. I'm in the School of Health Professions, and I want that same thing for you. I want you to find your passion, what you love to do. And in healthcare, you can always find a job. You're going to make a great living for yourself. So there's always job opportunities in healthcare. So when you think about what you want to do, in the next, couple of years, and as you're starting to kind of develop what you want to do, in the upcoming years, have a couple of plans. Like if your plan is to be, a doctor, I want you to do that. If your plan is to be a nurse, I want you to do that too. If a dentist, absolutely. But I also want you to think about all the other careers, which I'm going to tell you in just a second, that are in the School of Health Professions that are also in healthcare and that are great job opportunities. So our mission in the School of Health Professions is to provide the highest quality of education in interdisciplinary learning environment that fosters research, scholarly activity, critical thinking, evidence-based practice, leadership, professionalism. And we want to do all that while affirming the importance of ethical behavior, human diversity, service, and the team approach to healthcare. Because let's face it, in healthcare, it's a team approach. We're not just one profession. We have to understand our students are very fortunate to do a lot of interprofessional education, because in the healthcare industry, it's not one profession is better than the other. We have to work as a team. So that's really important to us in the School of Health Profession, and is really something we take pride in for our students. So I want you to take a moment to kind of scan this screen a little bit, and you can take and use that QR code, and you can go and any more of our programs. But I'm going to walk through a little bit about our school. So in the School of Health Professions, I have certificate programs, I have undergraduate programs, I have graduate programs, and I have doctoral programs. Our certificate programs are EMT, paramedic, and phlebotomy. Our EMT program, we offer we offer 3 times a year. We offer it in the summer, the fall, and the spring. This is a great opportunity if you're looking to apply to, medical school, or if you're looking to get those hours for your application. It's a great program. It's like I said, we offer it in the summer, the fall, and the spring. It's about, I think, around $1,200 for the course. It's all on our website. And again, it's a great opportunity. You need to be an EMT before you can be a paramedic. So that leads me into our next program. Our paramedic program is a non-credit certificate program. It's about a 10-month program. It's a very intense program. Both these programs are very intense because our students are in the fields. They're taking clinical rotations. Again, paramedic is a great job opportunity. The starting salary for a paramedic is around probably 90 to almost close to $100,000 right now. It's a very good job to do a paramedic, and there's a need for them. The other certificate program that I offer is phlebotomy, which is about a 6-week summer program, and that's under our Clin Lab Science program. We offer that in around June, July. Again, it's a 6-week program. All this information is on our website. So if you have more specific program questions about the program, it's all right there on our website. Now I'm going to go into my 3 undergraduate programs: my clinical lab science program, my respiratory care, and my health science. These 3 programs I'm going to go in a little depth later, but these are our undergraduate programs. In our health science program, we have clinical concentrations and non-clinical concentrations. Our clinical concentrations are medical dosimetry, radiation therapy, and radiological technology. Now, only a health science student can be applying to these 3 clinical programs. Again, you have to be a health science major to apply to these programs. They are applications. These students do have to apply for these. A medical dosimetrist is someone who's going to be working with a cancer patient, who's going to measure out that radiation, and is going to and then the radiation therapist is going to be administrating that radiation to that cancer patient. And then my rad tech students are the ones that are you're doing the MRI, CAT scans. Again, these three jobs have wonderful starting salaries, and we'll go into a little bit those later. I also have non-clinical concentration for the health science program, which our newest non-clinical concentration is our exercise science program. We have a lot of students who are interested in going into physical therapy, who are also interested in going into maybe athletic training. This concentration is a great concentration for those majors because it's going to give you some prerequisites. It's going to give you some courses that's going to help with that, like for example, kinesiology, exercise science. So again, great concentration for my physical therapy students and my athletic training students. Moving over to the graduate side, I have athletic training, physician assistant, speech language pathology, and applied health informatics. We have 2 campuses that our students are on. So for my physician assistant and my physical therapy and my speech language pathology students, we have 2 cohorts here at Stony Brook. So PA, we have a cohort at Stony Brook and a cohort at Southampton. And for PT, we have a cohort here at Stony Brook and a cohort at Southampton as well. For speech language pathology, that program is completely based out in Southampton. And then we have our applied health informatics program. Now, let's say you're interested in the healthcare industry, but you don't want to be patient facing. You don't really want to do clinicals. Applied health informatics is a great master's. We get a lot of students who come back to do this degree. We get a lot of nurses that come back to do this. This is going to focus on more of the technical side of the hospital industry. More of your right now that's kind of popular is your AI, the emergency medical record. This is going to be your IT kind of portion of the healthcare industry. Then moving over to my doctoral side, I have physical therapy, and our newest doctoral program, this is our 2nd year with our doctoral, is occupational therapy. We're one of the very few in the state to have this program, so we're very, very excited. Again, I'm going to go into more detail about my undergraduate programs, but this is a great kind of screenshot of everything that we offer in the school health professions. What do we do to prepare our students? We want to promote patient health and well-being by teaching the knowledge and attitudes and skills needed to ensure excellence in practice. We want our students to expand knowledge through transitional research, scholarship, creative activity, and we want them to be encouraged to innovate and take different methods and delivering high quality, cost effective in healthcare. And we want to respond to current and emerging public health challenges, both locally and globally, and develop those partnerships among faculty, staff, students, and the community. I will say, 2 professions that took a huge kind of salary review during COVID, which was my clinical lab sciences program and my respiratory care program. And the 2 reasons why for clin lab, one is because there was such a high need for the swabbing. So there was a need for a clin lab scientist. And my respiratory care students, with the ventilators and working on all that, we actually had to, graduate our respiratory care students early during COVID-19 because there was such a high demand for those students. They all received job opportunities practically by the minute they graduated. So again, there's a lot of opportunities for our students. And kind of continuing that, growing opportunities in healthcare, jobs can't be outsourced. So we can't outsource healthcare. So there's always going to be something here. We're living longer, and healthcare is practiced everywhere. So there's always going to be somewhere that there's going to be a facility that needs a healthcare worker. On my next screen is just showing you growth opportunities in healthcare, total employment, and versus the healthcare employment, and how that is growing 3 times as fast as the projected enrollment overall. This screen just kind of shows you from 2020 to 2030 the amount of the need for these professions. So the professions that are kind of growing in the next in this 10-year span, and even growing in the next 5 years: athletic training, which is under the School of Health Professions; physician assistant, which is under the School of Health Professions; speech language pathology, which is under the School of Health Professions; occupational and physical therapy. So again, these are all programs that we offer in the School of Health Professions, so it's a great opportunity. So just kind of focusing a little bit about respiratory care. Respiratory care, which is our undergraduate program in the School of Health Professions. Respiratory care therapists are highly skilled healthcare practitioners who think critically while treating patients. They work with anyone who has breathing difficulties. They also can work in different tons of populations: newborns, elderly, have a diverse career opportunities from education, management, therapy, and sales. And this population will also, this program will also work with the population. If anyone knows anyone who's dealing with sleep apnea, that's going to also be these students that work with that. And we do a lot with sleep studies. We have here at Stony Brook University a freshman declared opportunity for this major. So Stony Brook University freshmen can declare respiratory care as a major in the beginning of their freshman year. Students advance to the upper division after completing those program prerequisites by the end of their sophomore year and pass HAT 210 with introduction to respiratory care with a grade B or higher. So again, this is, if you were interested in this, you would meet with our advisors. We would get you on track, make sure you have those prerequisites. One thing I like to note is that an area of interest does not mean that you have this major declared, okay? It's not, just because you're an AOI doesn't mean you have the major declared. And when I say upper division level, meaning that you're going to do your freshman and sophomore year on the West Campus, because I am located actually on the East Campus. So once you finish your freshman and sophomore year, your junior and senior year, you would be advanced over to our side, and that's when you would take your respiratory care major classes. So average salary in New York is about $97,000. Now this is with a 4-year degree, okay? 4-year degree, no additional education needed. These students are walking out starting salary at $97,000. And US News World and Report is one of the best jobs we've never heard of, and the job growth is about 13%. It's growing very fast. My other not undergraduate program is clinical laboratory sciences. Clinical laboratory sciences, also known as medical laboratory science or medical technology. This health profession it focuses on the diagnostic and the treat of disease. They perform various laboratory tests, quality test results, new methods, effectiveness of laboratory results. They're working in maybe blood bank, phlebotomy. They can also do forensics. We're very lucky. The chair of our department, Professor Guglielmo, has a specialty in forensic science. She actually worked in the crime lab for many, many years. So that's another thing you could do with clinical laboratory sciences. A lot of job opportunity as well. Very similar, again, to my respiratory care program. We also have a freshman declared major here at Stony Brook University. Very similar, freshmen can declare this at the beginning of their freshman year. Students would advance to the upper division after completing all the prerequisites and taking HAD 210, Introduction to Clinical Laboratory Sciences, with an A- or better. Same thing as respiratory care. AOI does not mean that you are in that major. So even if you declared an area of interest for CLS, it doesn't mean that you have that major declared. Again, 4-year degree, around probably even a little higher than $80,000 right now, probably between 85 and 90 right now. Again, starting salary. So these students are starting at a great salary right off the gate, coming out of a 4-year degree. Now going into my health science major, I get a lot of questions that when I do presentations, if I am interested in going the pre-med track, or I'm interested in going to nursing, what major should I do? And I say to students, it really depends on what you really want to do. If you love, I say this all the time, if you really love biology and you want to really learn more about biology, then do biology. But if you want an overarching kind of focus of what the healthcare industry is, health science is a great major, and this is why. Our program mission in the health science major is to provide the highest quality of undergraduate education that integrates the principle of scholarship, ethics, cultural competency, communication skills, critical thinking, evidence-based practice, civic orientation, and to really understand the evolving of the healthcare industry. Our goals are for our students to think critically, independent thinking, understand the values of ethical, competent, and compassionate in healthcare. We focus on self-discovery, teamwork, evidence-based practice, and leadership. This is really important for our students to understand within the health science major. So again, if you're thinking about, a major, like I will say this now, and I'll probably get this question at the end too. There's no perfect major for a pre-med track. There's not a perfect major. So again, if you're really interested in going to different fields and in the healthcare industry, I really highly recommend health science. You could do a lot with a health science degree. Here at Stony Brook, especially at the School of Health Professions, we want to keep our students. So we want to keep you here for your graduate work. So we are starting a lot of health science like agreements. So to help kind of track within our graduate programs within the School of Health Professions. So again, a health science major degree will help you get into and apply for athletic training, physical therapy, occupational therapy, physician assistant, medicine, dentistry, an MBA, public health, nursing, speech language pathology, nutrition, and applied health informatics. And I'm going to go into more in a few minutes. The nice thing about healthcare is that you can couple things, right? So if you let's say you want to go into health administration, you could do that with a health science degree. One of our concentrations is public health. So again, a lot of opportunity with this major in the healthcare industry. Going into, again, another thing you could do with health science is an entry-level employment, patient advocacy, care coordinator, a medical scribe, disability services, healthcare management, personal trainer, health and wellness coach, research assistant, office manager. There's tons and tons of opportunities. The opportunities keep going. Health law. If you like to draw, you can be a medical illustrator, right? So you can do that. Sports management, pharmacy, psychologist, social welfare, art therapy, music therapy, and of course, you could even think about teaching. So again, with my health science major, there's a ton of opportunities that you could do within this major. Now focusing a little bit about what I spoke about my clinical concentrations. Now remember when I said during this presentation, to do any of these 3 concentrations, you have to be a health science major. So starting salary for my medical dosimetry students is about $115,000. These are very competitive programs. So for my medical dosimetry students, I only take 5 seats. For my radiation therapist, that starting salary is about $105,000. Again, starting salary. I only take 6 seats for these students. And then lastly, for radiological technology, about 80,000 if you're on days, about 90,000 for evenings. I take about 20 seats for this major. Again, these are for health science major students only. So if let's say you're a biology student, a biology major, and you want to apply to medical dosimetry, you wouldn't be able to, only health science. And then lastly, just about faculty, we are very lucky in the School of Health Professions that we have faculty that are still practicing, working on their research, focusing on different things, are in the industry, they're in the care, they're working clinically. So we're very, very lucky to do that and to have our faculty work in the School of Health Professions. Our students are required to do clinical rotations or practicum for their program. And of course, we are very lucky to be at Stony Brook University and in a teaching hospital where there is a ton of opportunity for our students to do a clinical rotation. For example, at the Children's Hospital, our newest location, which is at Lake Grove, Eastern Long Island Hospital, our Stony Brook Hospital, and many other opportunities, or any of our outpatient facility clinics. And lastly, I just want you to find what you want to do and love what you want to do. There's so many choices here at the School of Health Professions. We have a lot of pathways to careers in healthcare. We want you to have that sense of belonging. We take a lot of pride in diversity, equity, inclusion, and belongingness. So we do a lot of different workshops. Again, as I said, we do interprofessional education. So our students are not just working with their own profession, they're working with each other. preparation for the present and the future, value-added degrees with credentials, excellent workforce projections, and opportunity to work in teams and high-profile facilities. We want you to find your passion here at Stony Brook, and we hope it's with us in the school health professions. So again, these are some QR codes that I talked about. Our main page, which is the school health professions website, respiratory care, clinical lab science, health science, and this is a QR code if you want to contact me. So I'll stop now and if there's any questions.
All right, thank you so much, Teresa. We have a couple of questions in the chat here. So the first is, if you want to be a neuroradiologist, what program would you recommend?
I would probably say health science as an undergraduate degree. Um, there's always I think, like I said, I think health science is a very good overarching major for an undergraduate degree. And then as you kind of like get more into the major, you can talk to our advisors. And then you're going to want to research maybe even under the School of Medicine to kind of see the best kind of track or prerequisites for that degree. But I would say as an undergraduate degree, I would say health science is a great start.
And so you kind of called this question. First is, what would be the best course or track for a student looking for health science professions who wants to be a surgeon?
So again, there's no, as I kind of said earlier, there's no perfect major for pre-med. That is one thing I will tell you. It depends on what you really want to focus on. So if you love bio, if you love, whatever you love, then do that. But if you're looking for that overarching kind of like, what is healthcare? How am I going to get that like how do I know how to use communication? How do I, learn about ethics or healthcare issues? That's what we focus in our major in health science. So it's a very well-rounded major for our students in anything in the healthcare industry.
Right. And same student, can you be an EMT while going through the health science track?
So a great question. I don't recommend it just because they're both very rigorous kind of programs. So if you are looking to kind of do our EMT program, I kind of suggest, and you can always talk to our department chair or the department chairs of the EMT and the paramedic program. But I recommend doing it during the summer, just because it's a little easier, and it's not as intense because we do have classes in the summer too, but it's just it might be a little easier for you to do that instead of doing it during the full academic year. Because they will be required to do clinical rotations.
Absolutely. Can students have a double major?
They It's a little hard in our major. Well, not really so much in clinical. You can't really do it in clinical and respiratory care. We don't really see so much of it in our health science either, just because it's so intense. Like you want to make sure you have those courses complete. So we don't really recommend a double major. I'm not saying it's like not necessarily no, but it's something you would want to talk very early on to our advisors about.
Can you talk a little bit about the stats? So like GPA requirements, for example, for the health science program?
So we take a lot goes into our application and what we look for. So you want to be really heavy on your sciences, make sure you're kind of looking at those courses. Our GPA is around that we're looking for is usually around what the university GPA is. But like there's no perfect GPA, but like very high, like 90s around there, is what we're kind of looking for our major.
Wonderful. So can you study abroad as a health science major?
We do have some students that do that. Again, it's hard. That would be something I would definitely talk to our chair about. Um, just because of the nature of the program and just making sure that you're in line with those requirements.
Couple more questions here, and please keep them coming if you have things that you're curious about. How flexible can students be when switching between different study fields in health science?
Be a little bit more specific, like is it meaning like if like in concentrations or
Yes, so
okay. So you would as a health science major, so how the concentrations work is that when you get to your senior year, your junior year of your senior year, you're going to start thinking about what concentration you want, and then your spring semester of your senior year, you're going to focus on those concentration courses. So let's say, for example, you are interested in emergency critical care. You would have that as your concentration in your spring semester of your senior year, and you take those courses. You can cut once you're in the courses, you really can't kind of switch them because you're kind of starting them, and it's there. But again, we are very lucky to have two fantastic advisors here in the health science program, Tracy Thompson and Brianna Coach. So we start that conversation very early. So you want to have that open communication with your advisors, kind of talk about what your plans are, what you're thinking of. Let's say your plan is nursing, they'll give you a great kind of avenue of what kind of concentration is the best line for that to kind of help you prepare for to apply for nursing.
Thank you. All right, so is there a difference between radiation and ultrasound technician?
There is. We don't have an ultrasound technician program here. So radiation therapy is like what is going to be more so working with cancer patients. So administrating that radiation to that patient. Rad tech is going to focus again on MRI, CAT scans, and all that. We've gotten a lot of questions. I will take this back to our dean again, because we get a lot of questions about the ultrasounds, but we don't have that program currently.
Do students apply to a specific program or major, or just to health professions in general?
So you're gonna do, great question. So for the health science major, you're gonna apply that through the SUNY application, Common App, through undergraduate admission. Same with CLS and respiratory, you can apply. We're now our under the undergraduate program, so through the SUNY application and the Common App. For my graduate programs, so athletic training, I have to do it in order. Athletic training, athletic training, occupational therapy, physical therapy, physician assistant, and speech language pathology. Those are my graduate programs. That's going to be through our CAS application, which is a centralized application system. And then for applied health informatics, that's through our SLATE application on the graduate school. That's kind of how you apply for those programs.
And so you talked a little bit about East Campus and West Campus. Student is curious, how much time do students spend on each area?
A great question. So for my undergraduate programs, for anyone who's interested in CLS, respiratory, and health science, you're going to do your freshman and your sophomore year on that side of campus. Even for health science, your junior year, and then you're going to cross over to our side. So you're going to have a little bit of, you're going to have some time on the West Campus, and you're going to have some time on the East Campus. So majority of both, but when you're kind of crossed over and you're taking your courses here in the School of Health Professions, we're a summer term. So our programs start in the summer, and we go summer, fall, spring, and it's intense. So you're taking professional programs. They are very intense, rigorous work. So it's, you're gonna have time on both campuses, but when you're kind of on the East Campus, you're working.
And for guests who haven't had the opportunity to see campus yet and to come and experience Stony Brook, know that they're walkable from one another. So while we talk about East Campus and West Campus, it's not miles and miles apart. You can walk to East Campus from our admissions office or from really anywhere on.
It's a
on
beautiful walk too. So, when it's nice out, we have a lot of students walk. We have students can rent bikes or a scooter or anything like that. And we do have buses that will take, when it gets cold, they could take, and we have, they stop at the tunnel. We have a nice, beautiful tunnel that connects us from West Campus and East Campus. So it's not a far walk. It's actually a very nice, little walk here.
My colleagues and I have come over to East Campus for lunch a couple of times, so it's very, very quick, not far at all there. All right, so that seems to wrap up the questions. Oh, never mind, I totally lied. So what would you recommend for someone who wants to study anesthesiology ultimately?
Again, I would say health science is a great undergraduate program for those students. Again, for anything for anesthesiology, I always recommend when you have a specific kind of niche of kind of program, I always recommend if it's not here at Stony Brook, or if you know, anywhere you want to go, hope it's at Stony Brook. But contacting maybe the School of Medicine to kind of see again, like some prerequisites that you kind of want to look at. It's going to be heavy again in the science. So your anatomy, your physiology, those big science courses again, but there's no perfect track for these majors. Like you don't have to specifically take this major to be this. So that's why it's really nice. And we're very lucky in the School of Health Professions to offer the health science major.
Absolutely. All right. So, what is the acceptance rate for upper division programs?
So it's very competitive. So I'll just give you a little bit of like we have certain like a number of seats that we can take for each of our programs. So for respiratory care, we can take about between about 27, 28. Same thing for CLS, about between 26, 28. And then my health science major is much bigger. I think we're now up to maybe the second largest major on Stony Brook. We were the third, but I think we got bumped up to the second. So we're very large. And then for my graduate program about applied health informatics, I can take about 40 students. And then athletic training, I can take about between about 20 students. Physician assistant, which is a very competitive program. We have about every year about 2,000 applications, if not more. We take about 69 seats for that program. Physical therapy, I take 85 seats. Occupational therapy, which is our OTD, about 30. Speech language pathology, about 32. What am I forgetting? Athletic training, physical therapy, applied health. I think I got everybody. So again, our programs are very competitive. We are all accredited programs as well. So we have to kind of follow our accrediting body and all our guidelines.
I muted myself there. All right. Thank you so much. So one of the questions here I'll take is, what is the SAT score needed to join Stony Brook? And at Stony Brook, we are test optional, and we are truly test optional. So we do not require students to submit their SAT or ACT scores. If you choose to submit the SAT, you may do so. Our mid-range, so kind of the mid 50% of students who submitted last year who were admitted to the university, was a 1350 to 1470. Keep in mind that is only of students who submitted those scores. All right. So earlier you had mentioned students are required to work or volunteer at a hospital setting. Do you have to apply to the hospital, or are you connected through Stony Brook?
So unfortunately, and we get this question a lot too. A lot of things have changed since um post COVID. There's not a lot of like it's very hard to get volunteer opportunities in the hospital. So that's why I kind of focused on a little bit of our certificate program. So if you're looking for volunteer or hours or anything like that, it's great to kind of take the EMT course or even the phlebotomy course, because you're getting that exposure and then you could work. You're getting licensed. You could be a licensed, once you take the course for EMT, you're taking a certification, and then you get to be a New York State EMT. Same with phlebotomy. Once you take the course and you pass everything, you take that exam, you could be a licensed phlebotomist. So it's a great opportunity, and it just, unfortunately, the hospital, it's a lot of red tape to kind of do a lot of volunteering.
Right. And how early do students have to indicate what they're interested in studying or potential concentration?
I mean, you can have these as soon as you kind of like get into the health science program, you can start talking to our advisors. You're not gonna like pick your concentration until your senior year. So you have some time to kind of like feel it out and make those decisions. And again, it's always really helpful to have that conversation with our advisors to kind of see what you want to do.
Right. For our seniors who are in the room, please keep in mind that our early application deadline is coming up on November 1st. That is a completion deadline. That means the application and all supporting documents must be in by November 1st. I put in a link to the chat for our application information website. Again, that is November 1st for early action. If you're not interested in applying early action, you do have a little bit more time until January 15th, and that would be the regular decision deadline. I'll also put in a link here for our visit page. We encourage you to come and see and experience Stony Brook in person, whether it is at a campus tour, an upcoming virtual program similar to this. We do have a virtual campus tour for those who can't quite make it to campus but still want to really experience what Stony Brook is like. But we hope to welcome you to campus soon.
And I also just want to add to it, Megan, too, if you have any questions, please reach out to me if you want to see our facilities. We're very open to, have students come and come to our side of the campus, look at our labs, because you need to research and kind of see what you want to do. And we're very lucky here in the School of Health Professions to have a fantastic dean, Dean Gropak, who is very open to have, if you want to learn more about a class or if you want to, talk to our faculty, I can set that up for you. So like Megan said, if you want a tour, not only on the Stony Brook campus, but come to the east side. We want to show you our facilities as well. And we also offer information sessions. So all on our website on those QR codes, if you're interested about a program, because our programs are very specific, there's different requirements for every program and different prerequisites. Attend one of those information sessions to get more information about a specific program.
Absolutely. Well, Teresa, thank you very much for your time this evening. To all of our guests, we really appreciate it. If you have any questions, I know Teresa put the QR code to reach out specifically to her team. Otherwise, you can absolutely contact the admissions team. The emails that you've been getting for this link and for this webinar, you can reply right to them if you have any further questions.
I'm just gonna pull up
Perfect.
that screen.
Perfect.
There you go.
All right. And whether you are joining us from the East Coast or somewhere completely different, we hope that you have a great rest of your evening, day, night, whatever the case may be for you. And thank you so much. We look forward to seeing you on campus soon.
Thank you. Have a great night, everyone.
Have a great night, everyone. Thanks, Teresa.
Bye. Have a good night.